Hi, this is Dr. Bharadwaj. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics. These are the most common psychiatric disorders. Those are anxiety disorders. Of all the psychiatric disorders, most common, maybe in some stage or other stage of their life, every person might have experienced these anxiety disorders. These are the commonest of all psychiatric disorders. So we will look deeply into these disorders. What are these disorders? So what are the different varieties of anxiety disorders? Before we go deep into that, we have to understand every anxiety or every fear cannot be described as anxiety disorders. There are some specific rules for it. To understand the anxiety disorders more, we have to understand bit about DSM-5 and APA. So DSM-5 and APA, Diagnostic and Statistical Manual 5. Diagnostic and Statistical Manual is a classification system and diagnostic tool given by American Psychiatric Association. In order to describe a psychological disorder, or in order to classify the psychological disorders, you have to follow some rules. Those rules and regulations are given in DSM-5. American Psychiatric Association is the association of psychiatry practitioners and also psychiatry researchers and academicians who are scholars, professors, students, PhD scholars. All those people comes under American Psychiatric Association. They formed an association. So that association has come up with this classification system and diagnostic tool. You can consider this as a book as well. Their headquarters is located in Washington DC. There are many versions of DSM. The latest version, version 5, is released in 2013. Update to that version, known as DSM-5 TR Text Review 5th edition, is released on March 2022, and it has many changes compared to the one which is released in 2013. So what are those changes? Major changes are some of the new diseases are added, some of the descriptions are updated, and also there should be a link between ICD-11 and DSM-5. There are linking codes. Those codes are also updated. In that book or in this classification and diagnostic tool, the most important section is the section 2. It is known as diagnostic criteria and codes. It contains all the diagnostic criteria of a psychological disorder and also the codes. Here we have to understand when to use DSM-5 and when to use ICD-11. ICD-11 also have the similar structure, but ICD-11 is more generalized. It is developed by World Health Organization. It is more for all the diseases. So even it includes psychiatric diseases. Most of the people will follow DSM-5 because it is specific for psychiatric diseases. Any psychiatric disease, most of the people or academicians or the practitioners or the doctors, psychiatric doctors, will follow DSM-5. Whatever we are going to learn about psychological disorders, that is anxiety disorders, is from DSM-5. Coming to next section, that is anxiety disorders. Anxiety disorders are a part of diagnostic criteria and codes, that is section 2 of DSM. This section is divided into chapters. There are several chapters. In that, anxiety disorders deal with the chapter 5. Chapter 5 deals with the anxiety disorders. In order to understand different anxiety disorders, first we have to understand what is anxiety disorder and what is the difference between fear and anxiety. Excessive fear and anxiety are known as anxiety disorders. For example, if an individual is suffering with excessive fear and anxiety, those disorders come under anxiety disorders. And what is the difference between fear and anxiety? You all know that fear is a basic emotion, one of the universal emotions. Fear has different definitions when it is looked through different perspectives. But the perspective of from the anxiety disorders, as mentioned in DSM-5, fear is an emotional response to the perceived or real threat. This is the important one. Perceived immediate threat. So this is the important word, immediate. If you are undergoing any fear as of now, maybe you have encountered a thief or encountered a robber or you have encountered an animal in the wild, the immediate threat you have is known as fear. And what is anxiety? Anxiety has different definitions, but from this perspective, anxiety is the anticipation of future threat. You can see fear is the immediate threat, the threat which is happening now, and worrying about future is known as anxiety. So future threat is anxiety, immediate threat is fear. So these two definitions hold good from this perspective. If you go from another perspective, fear has a different meaning, anxiety has a different meaning. But in order to understand anxiety disorders from DSM-5, you have to keep in mind fear is for immediate threat, response for immediate threat. Anxiety is the anticipation or response for future threat. That is the important criteria here. And coming to anxiety disorders, there are several anxiety disorders. First one is separation anxiety disorder, selective mutualism, or specific phobia, social anxiety disorder or social phobia, panic disorder, panic attack specifier, agoraphobia. Some other anxiety disorders are generalized anxiety disorder. This is the most common anxiety disorder. Substance slash medication induced anxiety disorders, anxiety due to another medical condition, other specified anxiety disorder, unspecified anxiety disorder. So we will look deep into this, what are all each disorder within the anxiety disorders. So we will go one by one. First one is separation anxiety disorder. What is this? It can be a fear or it can be anxiety, fear of immediately losing a person or losing a person in future. Those comes under separation anxiety disorder. So if you are undergoing the process of leaving a person or separation from an individual in any circumstances who is attached to you, it can be a father, it can be mother, it can be a romantic partner, it can be a kid, it can be a friend. If you are undergoing this and you have the criteria which is coming under psychological disorder, basically this is the immediate fear or future anxiety about separating from a person. So this is known as separation anxiety disorder. Next one is selective mutism. Selective mutism is not speaking in some social conditions. For example, where you are supposed to speak. For example, if you are a student, if you are about to give or explain something to your fellow students, so you are not able to do that because of anxiety. Or you are a lawyer and you are not able to speak in the court, or if you are a teacher, you are not able to give the lecture because of anxiety or fear or any social situation, that comes under selective mutism. Selective mutism, one more important character here is these people are normal in other situations. For example, a teacher goes to a staff room and she speaks about it, and the students is comfortable with small group of his friends, so they can speak normally. Other than the situations, in some special situations where they should be speaking, they will not speak. That is known as selective mutism. Then coming to the next one, that is specific phobia. Phobia is fear or anxiety about a specific object or a situation. If you see something and you are afraid of it, if you are afraid of any particular situation, or if you are anxious about it, you feel that specific object or a specific situation is a immediate threat to you, that is fear, or it can pose a threat to you in future, that is anxiety. So there can be different situations and different objects. It can be animal. Some people are afraid about cockroaches, some people are afraid about spiders or any other animals, or basically this is other people feel on an average other people are not afraid of these animals, but you are afraid, then that comes under specific phobia. If other people are afraid and you are also afraid, then it doesn't come under phobia. You have seen a lion in the forest and you are afraid of it, it is normal, it is normal for all the other people, so that doesn't come under specific phobia. If you are afraid of a cockroach, see, cockroach is not a predator, but you are still afraid of it, and most of the people on average other people are not afraid of it, then it is considered as phobia. What other things like natural environment? What are the natural environment? One is mountain. If you are afraid of the mountain, if you are afraid of the depth, or if you are afraid of water, large amount of water like sea or river or anything else, all those comes under phobia of natural environment. And also specific phobia like blood injection injury. For example, some people are afraid of blood, some people are afraid of injection, some people are afraid of transfusion, blood transfusion, or any other medical care or injuries. So those are all comes under specific phobia. So we are all afraid of this, but it has to be a limit. If you are afraid of it or anxious more than required or more than an average person, then that is considered as specific phobia. And also situations, any situation. For example, I have seen a case where the baby cries after seeing the towel. What happened was the baby was lying on the bed, and one day brother has put a towel on his face, and they went away for 10 to 15 minutes. Baby is so afraid that whenever the baby sees the towel, she is afraid of that situation. There are many situations and many other situations. Some people are afraid of going into the lift, some people are afraid of being alone. So any phobia, any fear of a specific situation or any other thing comes under specific phobia. Next one is social anxiety disorder or social phobia. This is also one of the most common one. You can see fear or anxiety about social situations. When someone is watching you, for example, you have to go onto a stage and deliver a lecture, so other people are watching you and they are scrutinizing you. In such situations, if the individual is afraid or anxious more than an average person, then that is considered as social phobia. Some people you can see, imagine there is a room of many people and one person wants to go to washroom. They are afraid of going to washroom, or they feel anxious about going to washroom. All those situations comes under social anxiety disorders or social phobias. So see, everyone is afraid or everyone is anxious, but if you are feeling more anxious or more afraid compared to an average person, then that is considered as social anxiety disorder or social phobia. Of course, this has to satisfy the definition of mental disorders as described in DSM-5. Next one is panic disorder. Panic disorder is recurrent unexpected panic attacks. When you have multiple panic attacks, it is known as panic disorder. What is a panic attack? It is an abrupt surge of intense fear or intense discomfort. When you are afraid more than the required, then it is known as panic disorder. So panic disorder will have panic attack. This panic attack reaches to a peak within minutes. When you are afraid suddenly, what happens in this panic attack is there will be some physical and physiological symptoms like pounding of your heart, drying of your mouth, reeling sensation. So if the fear is at the peak, you have the fear intensifies within the minutes, within minute or 1 minute or 2 minutes, you have intense fear, intense discomfort, then it is known as panic attack. So if you experience this again and again, this is known as panic disorder. Next one is panic attack specifier. Panic attack specifier is same thing, abrupt surge, intense fear or intense discomfort. When you have fear suddenly and the fear reaches to its peak within minutes, that is known as panic attack specifier. In this panic attack specifier, you will have physical symptoms like you have pounding of your heart, you have headache, you have plenty of sweats, you will have giddiness, you have lot of weakness immediately within minutes. All these comes under panic attack specifier. So panic attack specifier or panic disease are most common one. In panic disorders, you will have multiple panic attacks. So what is a panic attack or a specifier is defined here. So you can see some of the people experience when they see their ex-partner. I have treated a case of panic attack. What happens? It was a young boy of 19 to 20 years of age. He had a breakup with his girlfriend 1 year ago, and she was moving in his college campus. So whenever he sees her for the last 3 years, they were together for 4 years. It was from an engineering college. So whenever he sees her, he will have this panic attacks. So that is a classical example. What happens to him is he is afraid, he is not able to concentrate on his work, and he is pounding of heart, his mouth goes dry, he has giddiness. All these sensations or symptoms he has described to me. So that is one of the best descriptions of this panic attack. Next one is agoraphobia. Agoraphobia is marked fear or anxiety about a particular situation. The situation can be a public transport, open spaces. Some people are afraid about open spaces, or some people are afraid about closed spaces, or they are afraid about standing in line or being in crowd, or they are afraid when they go out alone, they are away from the home. All these things come under agoraphobia. Agoraphobia is the fear of a particular situation. Those situation can be all this. Next one is generalized anxiety disorder. Anxiety disorders are the common of all the psychiatric disorders. Within anxiety disorders, generalized anxiety disorder is the most common. So what is this? This is anxiety or general worry. So some people come to my clinical practice and they say that my wife or my husband is afraid or is anxious of everything. He is always anxious. Even if he want to go to a movie, he is anxious. If something small happens in the family, he is anxious. And she says that even same thing with my kids. So the same anxiety problem has come to my kids, or same anxiety problem where my father-in-law has or mother-in-law has come to my husband or my spouse. So this includes generalized anxiety disorder recurring more than days, not for at least 6 months. So if a person is anxious or afraid generally for small things for more than 6 months, then it is considered as generalized anxiety disorder. It can be about number of events or a number of activities. It is not for a small one, or it is not for a single specific a situation or a single specific person. It is for a number of events and for number of activities. Some people we see they are always anxious to do anything. They want to go to movie anxious, they want to go to office anxious, they want to come home anxious. So this is known as generalized anxiety disorder. This is the most common anxiety disorder of all the anxiety disorders. Next one is substance or medication induced anxiety disorder. When a person develops anxiety or fear soon after a substance intoxication, withdrawal, or exposure to a medication. For example, some people become more anxious when intoxication. They have taken some alcohol, they become more anxious. So that is intoxication. Or they are taking alcohol for many years in higher quantities and suddenly they want to stop the alcohol. They have stopped taking the alcohol. That is withdrawal. Immediately after withdrawal, if they feel anxious, that is also comes under substance or medication induced anxiety disorder. Or exposure to any medication. You have a problem or you go to a doctor and he has prescribed some medication. That medication did not suit you and you have landed into anxiety. That is known as substance or medication induced anxiety disorder. You have to remember, it can be due to intoxication, taking excess, or it can be due to withdrawal. You are taking a particular chemical for a long time and you have stopped taking it suddenly. It is known as withdrawal. And also after exposure to a medication, you went to the doctor, he has given a medication. After taking the medication, you started being anxious or you have landed into fear. All this comes under this substance or medication induced anxiety disorders. Next one is anxiety due to another medical condition. This is also one of the common things we see. This is pathophysiological consequence of other medical condition. What it means is, if you are suffering with any other disease, because of that disease you have landed into anxiety. There are a lot of neurological disorders which we come across in general practice, where they have a disease. For example, I have seen this kind of neurological disorders in SSP, subacute sclerosing panencephalitis, Creutzfeldt-Jakob disease, Duchenne muscular dystrophy, cerebral palsy. Lot of neurological disorders, even not even neurological disorders, even other disorders are the basis for the anxiety or fear. Those conditions are classified into anxiety due to another medical condition. It is a direct consequence of pathophysiological consequence of other medical condition. So this you have to remember for this type of a anxiety disorder. Other specified anxiety disorders. So this is an important section within DSM-5. What it says is, a person has an anxiety disorder, but it cannot be classified into other anxiety disorders. So there are not symptoms fully available. The symptomatology is not fully matured, or symptoms are not available to classify it into the previous anxiety disorders we have seen. That can be classified into other specific anxiety disorders. So what is meant by specific here means, the physician can able to give why this is not considered as other anxiety disorder. Even though the patient is feeling anxious, patient is afraid, I'm not able to classify this under any of the anxiety disorders because of this reason X, reason Y, reason Z. If he gives the reason why he is not able to classify anxiety of this person into other anxiety disorders, and if he is able to give the reason, that is known as other specific anxiety disorder. So have symptoms but cannot be qualified as disorder. Disorders means the ones which we have seen in the previous slides with a specific reason. If the doctor can give the reason, this is the reason I am not able to classify this into specific anxiety disorder, then we give the category of other specified anxiety disorders. Next one is unspecified anxiety disorder. Patient has come to you, he is having anxiety or he is afraid, but there is no evidence or there is no fully matured symptoms to be classified that into the previously mentioned anxiety disorders, and the physician is not able to give a particular reason. So there is no reason, okay, XYZ, there is no reason, the physician is not able to give the reason, then it is classified as unspecified anxiety disorder. Unspecified anxiety disorder is simply anxiety or fear of a patient, but it cannot be classified into other anxiety disorders, and the physician is not able to give the reason why he is not able to classify, then it comes under unspecified anxiety disorder. And coming to the homeopathy treatment of anxiety disorders, so there are two important things patient has to remember, and patient is afraid of two important things when he wants to take the psychological treatment from a conventional doctor or a psychiatrist or a allopathic doctor or a corporate hospital or allopathic medicine or western medicine. The two reasons are, one thing is he is afraid of side effects, and he thinks that there is no permanent cure for psychiatric disorders in allopathic treatment. That is correct. But coming to homeopathy, so these are not a problem. Homeopathy treatment for any anxiety disorder, so there are no side effects, not even single side effect you see. In that way, taking homeopathic medicine is safe. And coming to efficiency, homeopathic medicines are far more better than any other available medicines in the other system of medicine in treating anxiety disorders. Anxiety disorders have the best treatment in homeopathy. First, we try to completely cure the disease. If not possible, homeopathy can reduce the intensity of the symptoms, duration of the symptoms, and also frequency of the symptoms. Not only intensity, frequency, and duration, and also we can reduce the number of symptoms with using homeopathy. Most of the cases can be completely treated without side effects in homeopathy. In Fidicus Homeopathy, we offer you two types of consultation. One is online consultation and in-person consultation. Online consultation, there are two, audio or video of your choice. You can make an audio call or video call. If you have any documents with you, you can share us, such as reports. If anything is required, we will let you know. We can do it locally and send it to us. We'll have a in-depth call or video call with us. We will ship the medication to your doorsteps. If it is in India, it will take 3 working days. If it is in US, it takes 4 working days. If it is any other country other than US, it will take 5 working days. Or else, if you want to come in person and take the treatment from us, call to this number 7997101303. Country code is +91. We are in India. You can come to our location and get the treatment done. We are Fidicus Homeopathy. Fidicus Homeopathy has the highest chance of health. We have the highest success rate for anxiety disorders. Our treatment is transparent and we take personal care. Thank you.